Hi and welcome to a new episode of your weekly medical TV show on الكرمة TV, White Coat. The transition that happened in the last 50 years in our diet and lifestyles affected our bodies a lot. Leaning toward processed food, fast food, and Western lifestyle that depends on a lot of protein, whether meat or chicken, had an impact on our digestive system. Also, the new lifestyle changes that happened and all the stress that we go through daily is part of the problem. And today we'll discuss two of those problems that resulted from that change. We will talk about irritable bowel syndrome, diverticulitis problem. In the United States of America, it's estimated that 10 to 15% of adult population suffer from irritable bowel syndrome symptoms, yet 5 out of 7% adults have been diagnosed officially with that disease. Irritable bowel syndrome is the most common disease of the digestive system, especially in younger population. Diverticulosis is quite common, especially as we age. Research suggests that 35% of U.S. adults aged 50 years or younger have diverticulosis. At the meantime, about 58% of those older than 60 years have diverticulosis as well. Most people with diverticulosis will never develop symptoms or problems. Experts used to think 10 to 25% of people with diverticulosis would develop diverticulitis. However, newer research suggests that the percentage who develop diverticulitis may be less only than 5%. In the United States of America, 200,000 people are hospitalized for diverticulitis each year. About 70,000% of those people are hospitalized for diverticular bleeding each year. Today, it would be my pleasure to welcome back on White Coat one of the outstanding physicians, Dr. Fariborz, to teach us more about that problem. For interaction with the program, send in all your questions and concerns to our official Facebook page, White Coat Alkarma TV. Or if you want to interact with my guest today, you can call the numbers that will be shown on the screen at any time during the episode. And we will be more than happy to answer and take all your questions. To keep up with us, follow our Facebook page, White Coat Alkarma TV, or follow us on Instagram, White Coat Alkarma. And to watch our latest episode, please subscribe to our YouTube channel, الكرمة TV, and activate the notification bell. أعزائي مشاهدي قنوات الكرمة في كل مكان في العالم، بحب أرحب بيكم في حلقة جديدة من برنامجكم الطبي الأسبوعي وايت كوت. الحقيقة النهاردة هنتكلم على موضوع common جدا بناء على طلب مجموعة كبيرة جدا من حضراتكم. هو actually هنقسمهم موضوعين. الموضوع الأولاني هنتكلم على القولون العصبي، أسبابه والكرايتيريا اللي يعني المواصفات اللي بنشخص على أساسها القولون العصبي. الموضوع الثاني اللي هنتكلم فيه اللي هو بنسميه الدايفرتيكيلوزيس أو الدايفرتيكيلايتس، اللي هو حدوث جيوب أو يعني نوع من النتوءات الخارجية في القولون، وده بيسبب مشاكل كتيرة. أحيانا بيسبب وجع في البطن مش مفهوم، أو بيسبب كمان أحيانا يعني مزيد من النزيف، وده بيعمل مشكلة وما بيتشخص بشكل كويس جدا. ناس بتتخيل انه شبه النزيف ده بيبقى شبه البواسير او حاجات كده، ولكن النهاردة اخترنا ان احنا نتكلم على مشاكل القولون بشكل عام اللي بتخص يعني برسنتج كبيرة. حسب الإحصائيات تقريبا عندنا 15% بيعانوا من فكرة القولون العصبي. الحقيقة احنا اخترنا الموضوع ده كمان النهاردة لأنه في مشكلة كبيرة جدا في الشرق الأوسط، أنه الناس لما ما بتوصلش لأي حاجة أو لما ما بتعرفش تشخص أي حاجة، أسهل حاجة بنقولها للناس أنت عندك قولون عصبي وخلاص، ونبتدي نشتغل على هذا الأساس. الحقيقة أنه القولون العصبي ليه جايد لاينز بيتشخص على اساسها. مش كل واحد عنده شويه وجع في بطنه او الكلام ده كله الاسهل بالنسبه لنا نقول له ان انت عندك قولون عصبي. الحقيقه نسبه كبيره جدا من الناس في مصر والشرق الاوسط متشخصين بفكره القولون العصبي، ولكن احيانا ما بيبقاش الدايجنوزس ده او التشخيص ده مظبوط بشكل كبير. الحقيقه احد اسباب امراض القولون بشكل عام هو اتجاهنا لتغيير طريقه الاكل او اللايف ستايل. في ال50 سنه الاخيره ابتدينا نتجه اكتر لفكره اللحوم المصنعه، ابتدينا نغير اللايف ستايل بشكل عام، ابتدينا ناكل بروتينات اكتر من الطبيعي، بالذات اللحوم والفراخ، اكتر ما بناكل الخضار او الفايبرز الالياف اللي جسمنا محتاجها. وده بيسبب الحقيقة مشاكل كتيرة جدا نتيجة التغيرات في الحياة مع سرعة الحياة جزء مهم جدا كمان في فكرة القولون العصبي اللي هو الاسترس اللي احنا بنعيش فيه بشكل كبير. بيبقى أحد أسباب أو أحد العوامل اللي بتؤدي لفكرة القولون العصبي وتغير في حركة القولون في جسمنا. فده مهم جدا ان احنا نناقشه مع حضراتكم النهارده. الحقيقه المرضين اللي احنا هنناقشهم عكس بعض في فكره السن. القولون العصبي بيجي اكتر في الشباب الصغير، يعني 40 فيما تحت بيبقى اكتر في الشباب الصغير. فكره الجيوب او الدايفرتيكيلوزيس، الجيوب بتاع القولون اللي بتحصل او النتوءات الخارجيه اللي بتحصل في القولون دي بتيجي لكبار السن اكتر فوق 50 سنه. الاثنين بيعملوا وجع شديد في البطن، ولكن كل واحد ليه صورة مختلفة، ليه طريقة تشخيص مختلفة. عشان كده اخترنا ان احنا نناقش ده مع حضراتكم النهاردة. الحقيقة بيسعدني ويشرفني ان يكون معايا واحد من احسن الناس في الموضوع ده، دكتور فاريبورز شمس. فالنهاردة هو هيعلمنا اكتر عن الموضوع ده. زي ما حضراتكم عارفين صفحتنا الرئيسية على الفيسبوك للتواصل معانا، اي اسئلة خاصة بالموضوع ده، الناس اللي بتعاني من فكرة القولون العصبي او الدايفرتيكيلوزيس يقدروا يبعتوا لنا كل اسئلتهم على صفحتنا الرئيسيه على الفيسبوك وايت كوت الكرمة تي في. تقدروا تبعتوا لنا كل اسئلتكم واستفساراتكم. كمان لو حضراتكم عايزين تتناقشوا مع ضيفي بشكل دايركت او ليكوا اسئله مباشره مع ضيفي، تقدروا تكلمونا على الارقام الموجوده على الشاشه. كل مره تقريبا الحقيقه يعني اعتقد ان حضراتكم بقى بداتوا تزهقوا من ده، ولكن السوشيال ميديا مهمه جدا. دعم قنوات الكرمة على السوشيال ميديا على كل البلاتفورمز مهمة، سواء على الفيسبوك زي ما حضراتكم شايفين صفحتنا على الفيسبوك، أو صفحة الرئيسية لقناة الكرمة على الفيسبوك. ده مهم جدا الدعم ده. صفحتنا على الانستجرام مهمة جدا، وايت كوت الكرمة. تقدروا لايك وشير، تقدروا تبعتوا لنا كمان كل اللي حضراتكم محتاجين تشوفوا الفترات الجاية. البلاتفورم الثالثة المهمة جدا اليوتيوب، زي ما حضراتكم شايفينها تقدروا تعملوا سبسكرايب ونفعل زر التنبيهات عشان يوصل لحضراتكم أحدث حلقات الكرمة من كل البرامج بشكل عام. الحقيقة يعني النقطة اللي أنا هتكلم فيها دلوقتي شوية بره فكرة موضوع النهاردة، ولكن وايت كوت كأحد برامج الكرمة اللي بتعظم قيمة العلم اللي اداهولنا ربنا. واحدة من الرسائل المهمة جدا في برنامج وايت كوت إنه العلم مهم، والعلم في الاخر احنا يعني ربنا هو اللي ادانا القدرة دي ان احنا نطور ونشخص في العلم بشكل كبير جدا. فواحدة من الرسائل اللي عايز اقولها انه يا ريت رسالة لكل البرامج الموجودة على كل التلفزيونات بشكل عام، لما نيجي نتكلم في موضوع علمي يا ريت نجيب الاشخاص اللي ليها كريدنشلز او المؤهلة انها تتكلم في الموضوع ده. مش كل شخص يتكلم في الأدوية ومش كل شخص يتكلم في الطب غير إذا كان مؤهل وعنده الكريدنشلز. رسالتي للجمهور وايت كوت إنه يا ريت نسمع للأشخاص المتخصصين في المجال ده فقط، مش كل واحد من غير كريدنشلز يتكلم في موضوع الطب والأدوية، لأنه الحقيقة بقى ده شيء مزعج جدا. الرسالة الثانية إنه العلم لا يتعارض مع وجود الله في أي حاجة، ولكن لازم دايما إعمال العقل والعلم، لأنه ده مهم جدا. ما ينفعش ناخد الاستثناء ونعمله قاعدة في أي حاجة. المعجزات استثناء مش هي القاعدة. القاعدة هي ان احنا نشتغل ونجتهد، لأنه ده جزء من الوزنات اللي ربنا اداها لنا، ان احنا نشتغل ونجتهد عشان يعني زي ما بنقول نوصل لأحدث حاجة في العلم نقدر نساعد بيها البشرية والناس كتير جدا. فده كان جزء مهم جدا من رسالة برنامج وايت كوت حبيت أكد عليها النهاردة. مش عايز اطول على حضراتكم. زي ما انا قلت موضوع القولون العصبي، موضوع النتوءات او الجيوب اللي بتحصل في القولون والمشاكل الناتجه عنهم، هيبقى ده موضوعنا النهارده. هنستنى اسئلتكم وهنستنى تعليقاتكم، ودايما بنقدر تفاعلكم معانا. يلا بينا نبتدي فقرات برنامجنا النهارده من وايت كوت.
Are you tired of being overweight? Do you suffer from diabetes? Do you suffer from hypertension? Do you suffer from obstructive sleep apnea? Do you suffer from hypercholesterolemia? Have you suffered from heart attacks in the past? Strokes in the past? Are you tired of being ostracized in public? Well, I have a solution for you. Robotic bariatric surgery. This can completely change your life. I'm Dr. Bobby Baskerau. I'm a robotic bariatric surgeon. I do robotic weight loss surgery, which can completely change your life. I offer 3 different types of surgeries that can completely change your life. The sleeve gastrectomy, the lap band, and the Roux-en-Y gastric bypass. One thing that's very unique about our program is that we have a dietitian, and you will get counseled on what to eat, what not to eat, and how to optimize the utilization of your tool for good weight loss.
Hello, my name is Dr. Fariborz Shams. I was originally born and raised in Tehran, Iran. I moved to the United States in 1976 and actually moved to Anaheim. I started my high school here in Anaheim, Lower High School, and graduated from high school, moved on and went to University of California, Irvine. I'm coming from a background of physician from generation and generation going back about at least 200 years. I have had every family member from the kings of Iran until me being a physician. So being a doctor have always been in my blood. And I have always looked up to my uncle, who was a great orthopedic surgeon back in Iran, and moved to Anaheim too. I finished up my undergraduate at UCI and basically moved on to Kansas City, Missouri. And I did my osteopathic medical education and graduated with the Doctor of Osteopathy from Kansas City, and that's when I moved to Detroit, Michigan to do my residency. I did 3 years of internal medicine residency, and that's where I met my beautiful wife, Salma, who was actually, I was the chief resident at that time, and she was starting her residency program. After I finished my chief residency at Michigan, I became board certified and moved back to where I started in Anaheim. And the hospital that I'm working with is West Anaheim. And interesting, this is the hospital that when I was going to high school, I used to work as a phlebotomist. Now I came back as a physician. I've been working here since 1995 in the hospital. Have been through a lot of different roles. With the latest one, I'm chief of staff at the hospital. And my wife actually came and joined me in internal medicine. She's an internist also. Now we have this practice in Anaheim. And my goal have always been to take care of the patient. And one of the requirements that I talk to my patient about is I consider them as my own family, and I want them to feel like they are part of me. We have a very good relationship with each and every one of my patients. I've been taking care of them for ever since they were kids. Now for 25 years, they're adult, and it's always been a joy. And that's a reward that I get. Other things that I have been doing here, about 4 years ago, I started internal medicine residency program at West Anaheim. Ever since I came to Anaheim, I really wanted to give back to the community, to help people. These doctors taught me, and I thought this is my responsibility now to teach them. So I have started a residency program, internal medicine 3-year residency program, and I have already have 2 graduate class. We're going into the 3rd year resident, and I'm happy to say they're outstanding. They have gotten fellowship position. They have started other practices throughout the country, and we're becoming top-notch, one of the best internal residence program. I have been always there, and I'm looking forward to be here again and taking care of all my family members in Anaheim. A few weeks ago, I was contacted from White Coat TV and to be talking and maybe reaching out to more patients, trying to help as much as I can. And I was very receptive. This is in line with what I do believe in, to giving back to community, to giving back to the people and helping people out. And I really like the idea, and I'm very enthused to do that. See you on White Coat on Alkarma TV.
من غير صلاتك ودعمك ما كناش أنتجنا كل البرامج دي. محتاجين لمشاركتك لاستمرار الإنتاج. لما بتعطي دايما بهدف، أو عشان تسد احتياج معين لشخص معين أو مكان معين. لما بتعطي في الكرمة مش بتعطي شخص ولا حتى مكان، انت بتشارك في رسالة حب، وبتشارك في نشر السلام، بتشارك في تنفيذ وصية إلهك. ما تتأخرش لما تجيلك فرصة، اعطي بس من قلبك.
اهلا بحضراتكم مره تانية في فقرتنا الرئيسيه النهارده، اللي زي ما انا قلت هنتكلم فيها، او حلقه النهارده هنقسمها اتنين بشكل عام. الجزء الاولاني هنتكلم فيه على القولون العصبي، اسبابه، طرق العلاج، وكمان الطريقه الصحيحه لتشخيص القولون العصبي. الجزء الثاني هنتكلم فيه على حاجه اسمها الدايفرتيكيلوزيس، اللي هو الجيوب اللي بتحصل في القولون نتيجه زياده الضغط جوه القولون نفسها، ودي بتؤدي لمشاكل كتير، منها وجع في البطن، منها احيانا النزيف الشرجي. فده يعني برضو بنشوفها كتير جدا في الناس اللي هم يعني شويه اكبر او فوق سن ال50 بشكل عام. دول هيبقوا المين سيجمنتس او الفقرتين الرئيسيتين اللي هنتكلم فيهم في برنامجنا النهارده. It's my pleasure and honor to welcome back on White Coat one of the outstanding physicians in Southern California, Dr. Fariborz Shams. Welcome, Dr. Shams, back on White Coat.
Thank you for inviting me.
It's always pleasure and honor having you in White Coat. Even on a personal level, I really enjoy it. So today we'll divide our segments today in two main segments. The first one we'll talk about irritable bowel syndrome. A lot of people get diagnosed with irritable bowel syndrome with not established criteria just for the diagnosis. We live in the irritable bowel syndrome, and I was saying in my intro, it's way overdiagnosed in the Middle East. A lot of people just get overdiagnosed with irritable bowel syndrome. So it's always have criteria to diagnose and all that stuff. And since the two main segments, we're talking about an organ called colon. So what is the colon, and what's the structure and function for that organ?
Well, again, thank you for inviting me back again to the program. Appreciate it. It's interesting, yes, it's IBS or irritable bowel syndrome. It's diagnosed, quite frankly, because when we don't know what it is, we just put it in that bag. It's called IBS. But go to the root of it. The colon is a very large part of large intestine. We have two parts. We have small intestine and we have the large intestine. So colon is the large intestine, and it's about 5 to 5.5 feet long, and the diameter of it is about 2.5 inches. And it's located from, it goes from the cecum, which is on the right side, goes all the way up, down to the rectum. It divided basically into 4 sections. So if you look at the slide 2, we can see the area that goes up is called ascending colon.
Slide 2. Mm-hmm.
Then we go through the transverse colon, descending colon, and sigmoid, which basically connect to the rectum.
Okay.
So that's the 4 different part of colon, and it uses, the body uses the colon as basically storage of the feces, and that's where most of the water and things get absorbed. So that's what the colon, the big part of colon is.
So when we say irritable bowel syndrome, what do we mean by irritable bowel syndrome?
Colon and nervous system, it's a syndrome. And it's basically what we used to say, one man's constipation is another man's basically normality. And we still to the date don't know what the cause of the irritable bowel syndrome is. And that's why I said, we don't know what it is, we always put it in that package of irritable bowel syndrome. 20% of these symptoms that we're going to talk about in a bit is basically after some sort of gastroenteritis, basically flu or infection or what have you, it comes up. So that's what the IBS is.
Okay. So what I like about what you said, it's not a disease, it's a syndrome. So it's a lot of symptoms. We put it together and we get the diagnosis of irritable bowel syndrome.
Exactly. It's not like, like diabetes. It's not that. It's just basically the symptoms you have. And we're going to go through this like constipation, diarrhea, pain, and bloating, and all those kind of stuff. It's a syndrome. It's a syndrome that goes on.
So it's not a disease, it's a syndrome.
It's a syndrome. You
And
have
up
to
to date,
remember
like,
that.
I still remember your words about diabetes. It can be the easiest disease in the world or the hardest disease. And I always tell my patients that.
Exactly.
So it's a syndrome, not a disease. That's our quote for the day.
Please remember that. Yes.
Alright. الحقيقة سؤالي الأولاني دكتور شمس كان عن القولون بشكل عام. ايه هو القولون؟ احنا قاعدين نقول القولون ده عبارة عن عضو في الجسم بيتكون من 3 أجزاء بشكل عام. معلش لو نحط السلايد تاني بتاع القولون رقم 2. هو عبارة عن 3 أجزاء، جزء منه صاعد زي ما بنقول، مستعرض ونازل. فكرة القولون بشكل عام قائمة على حاجتين، اللي هو أو بنسميها باللغة العربية يعني الأمعاء الغليظة زي ما بيسموها يعني. كمان هي فكرتها الفكرة كله إن هو استمرار للأمعاء الدقيقة بشكل عام. العضو مهم جدا في جسمنا، بيتم فيه المرحلة الأخيرة من امتصاص يعني المواد اللي احنا جسمنا محتاج يمتصها. كمان الإخراج، فكرة الإخراج إنه بنتخلص من المواد اللي احنا جسمنا مش عايزها بشكل عام. ايه هو القولون العصبي؟ ده كان سؤالي التاني لدكتور شمس. القولون العصبي زي ما هو قال مش مرض بعينه نقدر نقول انه ده مثلا عنده ضغط او عنده سكر، هو سيندروم، هو مجموعة من الاعراض لما بنحطها كده جنب بعضها بنقول انه الشخص ده بشكل عام عنده القولون العصبي. عشان كده زي ما هو قال انه كتير من الناس جدا get over diagnosed، يعني بتتشخص بشكل كبير جدا بفكرة القولون العصبي وهم في الحقيقة ما بيبقاش عندهم القولون العصبي. يعني واحدة بواحدة هنقول لحضراتكم ايه هي الكرايتيريا اللي بنشخص على اساسها فكرة القولون العصبي بشكل عام. As I always say, statistics are important and it shows us like how big is the problem. So how big is the problem that we're facing today?
Well, it's pretty, statistic part of it is 50% of this patient, first it was described back, IBS, I have to say, 1771.
Right.
And 50% of these patients are basically less than 35 years old. So this syndrome is a syndrome for younger generation.
Okay.
And in the old days, we used to say IBS was college student syndrome, we used to call it that,
Right.
because we had a lot of nervous, related to the nervous system, and people during the exam time, they get nervous, or get all the symptoms of it. So that's what, but majority of more than 50% are basically less than 35. Interestingly enough, 70% of these people who suffer the symptoms, after the 5 years, the symptoms are basically resolved, and it's gone. So, and most of these symptoms are diagnosed, general practitioner, family practice, internal medicine people see this patient and diagnose them.
Okay.
About 40 to 50 of this per 2,000 patient is basically, that's quite a few. Again, the misconception, if you don't know what's going on, we always put it in the bag of IBS. So.
Right. To the point that there is, like, one of the studies and statistics are showing that 20 to 50% of the gastroenterology visit outpatient is because of the irritable bowel syndrome. It's just some symptoms.
Something, yeah. I mean, they don't know, so we send them to the GI people.
Right. Just get rid of them. الحقيقة برضو مهم دايما ان انا يعني كل حلقة تقريبا بنوري حضراتكم بعض الاحصائيات عن كل مرض بنتكلم عليه. الحقيقة واحد من الامراض اللي ليها احصائيات يعني انا بشوفها زي ما بنقول انه هي فاني جدا. 50% من اللي عندهم الريتابل باول سيندروم بيبقوا تحت سن ال 35. دكتور شمس كمان قال ان احنا دايما يعني 10 15 سنه فاتوا تعودنا نسميه الناس مرض الناس اللي في الكليات والمدارس على اساس ان هو شويه اعراض ويعني فيها جزء ستريس زي ما بنقول. فلما ما بيبقاش اي حد عايز يروح المدرسه او الكليه بتاعته هو بس كده بيقول يعني اي حاجه عشان ما يروحش وخلاص. 20 ل 50% من الاوفيس فيزيتس اللي بتروح للدكاتره لزياره الدكاتره في عياداتهم بتبقى بسبب الirritable bowel syndrome. فنسبه كبيره جدا لازم زي ما بنقول نحطها بعين الاعتبار قبل يعني ما نشخص بس وخلاص قولون عصبي عمالين نشخصه ليل ونهار على الفاضي. So let's talk science now. Diagnostic criteria for irritable bowel syndrome. Because I think that's very important to follow guidelines, not just to diagnose every patient with irritable bowel syndrome.
Yeah, that's absolutely true. And I have to say, basically the ratio, if you go by the ratio, females much more than males, basically almost about 3 to 1 female get this syndrome. So the way, there's a couple of ways that we have, we label and we have the diagnosis. At least we have to have 12 weeks history of consequent abdominal pain, discomfort, that is relieved by defecation.
Okay.
That's one of the things. Number 2 is associated with changing the stool frequency.
Okay. So it goes between constipation and diarrhea?
Constipation, diarrhea, and onset associated with changing form of the stool. Okay. Now, if we look in slide 7, and it goes through the diagnosis of the criteria.
Okay.
One thing is, I said 12 weeks. It doesn't have to be exactly one after another.
But at least 12 weeks.
12 weeks of it in that period, 12-month period.
Okay.
So in 1 year, if you have any of those things, the total of 12 weeks, basically that's one of the diagnosis criteria.
Like total of 12 weeks in 1 year?
1 year, exactly.
In 1 calendar year, okay.
Correct.
So what other symptoms that we can have beside change in frequency, change in stool consistency and stuff?
With the IBS, basically, the different form of them. So we have the IBS, we call it IBS-C, which is constipation, IBS-D, which is for diarrhea. And it doesn't mean that it's always have to be one or another. As I said, it's interchangeable. Sometimes people have constipation for a while, sometimes it's diarrhea. So for the constipation, it's predominantly you have to have slides. Next slide will show the criteria of basically having at least bowel movement about 3 times a week. That's for constipation.
Okay.
Having a hard, lumpy stool, and having the straining during the bowel movement.
Straining. Mm-hmm.
That is for the IBS-C, which is the constipation one.
And sometimes they feel like they don't evacuate it fully.
Completely.
Right.
Exactly. It just does not go. They feel like they have to go back again.
Okay.
And very uncomfortable feeling. Now, on the other hand, on the other side of the spectrum is the IBS-D, which is the diarrhea part of it. That is one of the criteria is they have to have like 3 bowel movements per day. Loose, mushy, very soft, watery kind of stool, and having that urgency that they need to keep going to the bathroom. And that's the criteria for the IBD.
Okay.
Diarrhea.
I have like one of our questions here. She's asking if it's related to her menstrual cycle.
Very interesting question. Hormones play a very, very rules
Important
in this syndrome. And as I said, one of the things is the nervous system. And as we know, hormones does affect the nervous system of the body. So directly a menstrual period causing the IBS, I don't think it's that. It's indirect cause of it, that the hormone causing the nervous system and nervous system causing the either diarrhea or constipation. So your question is very correct,
valid.
probably valid, yes.
Okay. الحقيقة كنا بنتكلم على ايه هي الأعراض اللي ممكن تكون موجودة أثناء يعني أو المريض اللي عنده السيندروم دي، لأنه زي ما اتفقنا القولون العصبي هو مش مرض بيشخص زي يعني بأرقام، زي الضغط، ضغطك لو فوق كذا يبقى عندك ضغط، السكر لو سكرك فوق كذا. لا دي مجموعة أعراض لما بنجمعها على بعض بتوصلنا لفكرة إنه البيشنت ده أو المريض ده عنده فكرة القولون العصبي بشكل عام. زي ما قال دكتور شمس، الحقيقة فكرة القولون العصبي إنه 12 أسبوع خلال السنة، يعني تقريبا 3 شهور من خلال السنة بيحصل إنه الباول هابتس نفسها بتتغير، إنه المريض بيروح من فكرة الإمساك للإسهال. كمان بيتغير في فكرة الفريكونسي نفسها، كم مرة البيشنت ده بيدخل التواليت، لأنه ده مهم جدا. في عندنا نوعين مهمين من فكرة القولون العصبي. قولون عصبي بيميل أكتر لفكرة الإمساك، ده تقريبا بيدخل التواليت أقل من 3 مرات في الأسبوع. كمان فكرة النيتشر نفسها بتاع الستول بيبقى صلب جدا زيادة عن اللزوم، وبتبقى كمية البراز نفسها قليلة جدا وبيبقى صلب بشكل كبير. في كمان القولون العصبي اللي يميل أكتر للإسهال، ده بيبقى تقريبا إسهال 3 مرات، أكتر من 3 مرات في اليوم. بيبقى يعني الإسهال هو اللي غالب فيه على فكرة الإمساك بشكل عام. كمان بنلاقي مرضى القولون العصبي واحدة من العلامات المهمة جدا إنه بيجوا يقولوا إحنا مهما ندخل التواليت ما بنحسش إن إحنا فضينا كل حاجة أو فضينا القولون بتاعنا، فبيضطر يدخل التواليت أكتر من مرة عشان يجيله الإحساس إن هو فضى القولون بتاعه completely. فده بيبقى شيء مهم جدا. زي ما أنا قلت كمان فكرة إن أنا أروح ما بين الإسهال للإمساك أو الإمساك للإسهال والتغير في الشكل العام، ده برضو واحد من الدياجنوستيك كريتيريا المهمة جدا، أو واحدة من الحاجات اللي بنشخص بيها فكرة القولون العصبي بشكل عام. How's the abdominal pain and bloating and all those stuff? Is it part of the syndrome that we're talking about?
Yeah. You get, yes, you get, as I said, you get bloating, you get either diarrhea or constipation, feeling of incomplete evacuation, and sometimes the patient comes and says they're passing some mucus through the rectum and become very concerned about that. But these are all the symptoms. But the most bothering some to them is just this uncomfortable bloating feeling,
right.
That it looks like I'm pregnant and it's just cramping and stuff like that. So
right. When we say criteria, I think there is many criteria because like I really want to stress on this point, just not to overdiagnose a lot of patients with irritable bowel syndrome. So what are those criteria that we can go
Yeah,
by?
there's another criteria called Manning's criteria. There are more features that have to be presented at least for 6 months. And looking at slides 10, we go through this Manning criteria. First one is pain, which is relieved by defecation. Usually, I ask him, so how does it feel? He says, yes, my stomach does feel better when I go to the bathroom, have a bowel movement. So that's one of them. And you have to have basically three or more of these criteria for the 6-month period to be having the syndrome.
To be
so
diagnosed.
that's why I'm going through this. So you ask him pain onset associated with more frequent having bowel movement. Yeah, you go to the bathroom and the pain goes up, and I have more pain at that time. Looser stool with pain onset. Ask him, okay, so where is the pain? It's all over, and basically after the pain, I have loose bowel movement.
Okay.
So abdominal distension, as I said, that's really important. It's very concerning to the patient that, it's just my stomach I'm not eating much, but my stomach is getting bigger, it's cramping, it's bloating, and I have more gas. So another criteria.
Okay.
So before mucus in the stool. That's important.
That's very concerning to them.
Very concerned, because patients do get concerned that, there is something wrong with me. And always the thing of the brain is, I have a cancer, is something coming out of me, or that's very concerning. So no, it's not. That's part of it. So, and again, the thing that is, they say, you know what, I go to the bathroom, I just don't feel like done, I have to go back again. And that feeling is very uncomfortable. That's part of another criteria.
Okay.
So you have to have at least 3 of these criteria for the period of 6 months. That's it's called Manning criteria.
Manning criteria. Okay. الحقيقه برضو السؤالي لدكتور شمس كان عن ايه هي الكرايتيريا اللي بنحدد بيها فكره الirritable bowel syndrome او الاعراض. قال انه في عندنا 6 اعراض، لو عندك 3 منهم خلال 6 شهور في السنه او انا اسف من 3 شهور ل 6 شهور في السنه الاعراض دي بتيجي عندك، بنشخص بيها، واللي يعني اللي هي الاعراض زي ما بنقول المعتمده لفكره القولون العصبي. اولهم على الاطلاق انه دايما الشخص بيبقى عنده وجع في بطنه شديد جدا طول الوقت، والام في جسمه بشكل عام، ويحس انه عنده انتفاخ وغازات. ده كله بيروح اوتوماتيك اول بس ما يدخل التواليت، فالبين ده بشكل عام او الالم بشكل عام بيروح مع ده. الحاجه الثانيه انه دايما وجع البطن والحاجات دي بيبقى اكتر في مرحله انه البراز بياخد شكل اللوس ستول بشكل عام. فدي برضو واحده من الحاجات. الحاجه الثالثه انه بيبقى فيه انتفاخات كبيره جدا طول الوقت. كل ما البيشنت ده او المريض ده ياكل اي حاجه يحس انه مش عارف يهضمها، ياكل حاجات قليله جدا ويحس انه شبع، عنده احساس دائم بالشبع نتيجه الانتفاخ والحاجات دي. بعض البيشنتس بنلاقي بعض المخاط في البراز بتاعهم، وده برضو بيبقى من الحاجات اللي بتبقى كونسيرنينج جدا بالنسبه لهم. نقطه تانية زي ما انا قلت، واحده من العلامات المهمه جدا انه دايما ما بنحسش ان احنا فضينا القولون بتاعنا لما ندخل التواليت، وبيضطر البيشنت او المريض يدخل اكتر من مره التواليت عشان يحس انه فضى كل القولون ويحس براحه اكتر. دي بنسميها حاجه اسمها مانينج كرايتيريا. الكرايتيريا دي هي اللي بنشخص، بندي البيشنت كده مجموعه من الاسئله يجاوب عليهم اذا ده عندك او ده مش. الكرايتيريا دي زي ما انا قلت لو هو عنده 3 من 6 من الكرايتيريا دي عاده بنشخصه بفكره القولون العصبي. زي ما قال دكتور شمس كمان السيدات بيجي لها اكتر من الرجال تقريبا بنسبه 3-1. صغار السن زي ما قلت 40 او اقل بيبقى منتشر جدا فيهم. الناس كمان اللي عايشه تحت ضغط عصبي شديد جدا بيبقى واحد من الاعراض المهمه. دي كرايتيريا لازم نروح بيها، مش كل واحد عنده شويه وجع في بطنه روح انت عندك قولون عصبي خلاص. في كرايتيريا او في محددات بنمشي بيها، مهم جدا ان احنا نشخص على اساسها. So what are the other associated symptoms with irritable bowel syndrome patient can experience?
One of the big things with IBS, as I said, colon is a big organ. It's a big tube that is used for storage and water absorption, but it does have nerves around it. Nervous system does control it. So I don't want people to think it's all in my head, it's nervous. No, it is not. It's actual symptoms. You have the bloating and stuff. But the CNS does play effect in it.
Stress play a role.
Stress, depression, and they have found out 25% of people have depression with this syndrome.
Okay.
Other 25% have anxiety.
Wow. So 50% of those people have psych element in the
The problem with this is when you say psychiatric, people think, you know what, it's all in my head, I'm crazy, and that is not the fact. That is just means you're either depressed, you're anxious, and affecting the nervous system that goes to the colon. So that's one of the associated symptoms of psychiatric disorder, depression, anxiety. And the thing is that because of that, they don't consult the doctor. They don't want to say, okay,
it's in my head, I'm going to get better.
Exactly, exactly. So, and in one study, 70% of the IBS sufferer had dysphoria, and which is basically, again, not that it's craziness, it's just psychiatric. It's just the brain is a fascinating organ. So that's one of the associated symptoms of it. The other stuff like a stressful life event, and that's why, if you remember, I said this used to be a while back, 34 years ago, we used to call it actually college student disease. So because of the stressful during the exam time. And it is found that it is it's more popular in the less educated and poorer general health people. And the point that I brought before, the fascinating part of it is the ratio, woman to man. There is 3-to-1 ratio.
Right.
So tell me, probably women are more emotional.
They're more sensitive.
Very sensitive, very sensitive. We can
الحقيقة برضو سؤالي لدكتور شمس كان عن الأعراض اللي بتيجي مع فكرة القولون العصبي. قال إنه تقريبا 25% من السيدات اللي بيعانوا من فكرة القولون العصبي بيبقى عندهم depression أو اكتئاب. 25% من السيدات اللي بيعانوا من فكرة القولون العصبي بيبقى عندهم زي ما بنسميها حالة القلق والتوتر العام generalized anxiety disorders. فمهم جدا انه 50% من السيدات اللي بيعانوا من فكرة اضطراب القولون او القولون العصبي بيبقى عندهم حاجة يعني psych element زي ما بنقول، جزء منه بيبقى نفسي بشكل كبير جدا، لانه لو عندنا 100 سيدة عندهم قولون عصبي، 25% او 25 سيدة عندهم اكتئاب، 25 سيدة عندهم حالة قلق وتوتر عام بتبقى مصاحبة للكلام ده. فمهم جدا ان احنا نحط فكرة الاسترس كجزء من الصورة. لما البيشنت بيجي كمان قبل ما نشخصه ده لازم يعني نعمل اسسمنت كويس قوي للستريس او الضغط اللي موجود في الحياة بشكل عام. كلنا عندنا ضغوط سواء مادية او عائلية او في الشغل، كل ده بيبقى جزء من الصورة زي ما بنقول. وزي ما قال دكتور شمس بالنسبة للسيدات 3-1 من السيدات، يعني لو في 4 عندهم قولون عصبي 3 هيبقى منهم سيدات، 1 فقط من الرجال. Subtypes, can we say them quick one more time? Yeah. What's the types of irritable bowel syndrome that we're facing?
Yeah, so the IBS, basically I divide them into 3 parts. The first two parts is the IBS-D, which is the diarrhea part, divided into the diarrhea, IBS-C, which is the constipation part. So diarrhea, constipation, predominant, and as I said, we can just have it back and forth. It doesn't have to be exclusively one. Right. But predominantly diarrhea or predominantly constipation. The third one is the pain predominant. That is just the pain is really unbearable. Okay. So those are the subtypes.
It is, what I want to confirm here, it is real pain. It's not in their head.
And that's why I really want to stress to the viewers that it is not in your head. It is not that you're crazy. It is not. It is a real, absolute pain.
Okay. I have another question here. One of our viewers, she's asking, is it related to the nature of the bowel movement itself? Like how the colon moves?
How the colon moves, well, it does contribute to it. Because, as I said, if it's just... if it's IBS constipation, if you take too long for the stool to go through the colon, the movement slows down. You take medication that causes the slowdown in the movement. It becomes more constipated, become more painful. So in that respect, yes, it is related to the bowel movement, basically. It's just symptoms. It's a syndrome, as I said at the beginning. It's a syndrome. It's not a disease. It's symptoms of constipation.
Perfect. الحقيقة برضو نقطة مهمة جدا عشان بس برضو نأكد على فكرة القولون العصبي. ناس بيبقى عندها فكرة الإمساك أكتر من الإسهال على مدار السنة، ناس تانية بيبقى عندها الإسهال أكتر من الإمساك، ولكن العامل المشترك في كل دول سواء ده أو ده، وفي ناس بيبقى عندها الاتنين بيجوا مع بعض، شوية إمساك شوية إسهال، بس المشترك العام فيهم كلهم هو فكرة آلام البطن الشديدة جدا. وأحيانا لما يعني كتير جدا من البيشنتس يروح لدكاترة ما يلاقوش حاجه يقول له ده بس في دماغك انت بتدلع، الحقيقه لا، انه في حاجه اسمها قولون عصبي. حركه القولون نفسها، الانقباضات اللي بتبقى في القولون نفسها دي بتبقى في وقتها بس ما بنقدرش نشوفها كمان باي حاجه، وبالتالي فكره انه المريض بيبقى بيعاني من الم في البطن، ده بيبقى الم حقيقي مش في دماغه بس زي يعني ما بنقول. Why it's important to exclude other diseases and how we diagnose irritable bowel syndrome? Do we go by questionnaire? Like, how do you diagnose it?
Yeah, good question. Yes, again, this is a real syndrome and real pain, real symptom that you have a constipation or diarrhea. So the most important thing is examination.
Okay.
And not only in this, in everything I tell them, patients a wealth of information. You just take the time and sit down and talk to the patient and listen to him. They basically give you all the result. So by just talking to him, getting a good history, when does the pain come, how do you relieve it, what do you do for it and stuff, it's give you a lot of information. Then you move on to actually putting hands and examining and see what's going on. Is it abdomen is soft, it's distended, there's a lot of air you can hear, it's hyper sound, the sound is high. Rectal exam, see how the tone of it is. I get a lot of questions, is it good to do sigmoidoscopy, colonoscopy?
Great.
And
that was my next question.
Your next question, yes, because I get that in the office a lot too. Basically, there is no really consent that, it's something worth doing. Or not, it all depends on the symptoms. And again, if you just, the best tool is the history. The best tool is talking to the patient and getting all the symptoms.
Is it important to exclude other kind of disease?
There is a lot of other things that...
Because sometimes we neglect them and then we're facing a disaster later on.
And that's why I always say to my resident that, you know what, once you have tunnel vision, you're doomed. Right. Never, ever, ever, ever just look at the tree. There is a whole bunch of forests. And
I love that. Don't have tunnel vision. Always, for all practitioners listening to us, do not have tunnel vision.
Please, for the sake of your patient, for the help of the people, do not have tunnel vision. And that's the most important thing. And it's not about the IBS or diabetes or anything else. It's just about, in general, medicine is a big field.
Right.
And everything could be happen. And I appreciate you bringing this up because people could have diarrhea for other reasons. There's many, many other things, or constipation. So just don't say, well, we don't know what it is, so it's IBS.
Okay.
Rule out other stuff.
Let's take some phone calls. We have some phone calls.
Would love to.
Okay. جوزيف من كاليفورنيا معانا على الهواء. اتفضل يا فندم، حضرتك معانا على الهواء. ممكن لو سمحت توطي التلفزيون شوية؟ جوزيف لو سمعني، اسمعنا من التليفون، توطي التلفزيون شوية. جوزيف ممكن توطي التلفزيون شوية وتسمعنا من التليفون بس عشان الإيكو هنا؟
Oh, yeah. Can you hear me now?
Sure, yeah, I do. Go ahead.
Okay, good. So yeah, I was watching your program and it's pretty interesting because everything that you were saying, it's like, Baruch Hashem, I'm like going through so much stress in this country as a political refugee.
Okay.
Very corrupt country, the United States, unfortunately. And I have all these problems
Please,
right now.
let's not get to the political part. Just tell me your symptoms and how can we help.
I'm really sick because of the stress.
Okay. So what's your question?
So how do I get some healing from all these things?
How you get some healing? That's your question?
Yes.
Okay. So treatment, basically.
Well, again, the treatment is what And as you said it very good, you know, it's about all the stress that you have, everything that have happened, and so sometimes the treatment is relaxation, sometimes it's medication, sometimes it's getting help with a professional, like a psychologist, psychiatrist. And I don't want people to think psychiatrist, because when you bring a name of psychiatrist, people say, oh, you know, that's for psychotic people, mass murderer, crazy, and that's not true.
Right.
Absolutely.
I love this point too. Like, it's very important.
It's very important.
Right.
People don't understand. It's just like diabetes. If you're diabetic, you know, you don't have insulin. It's not your fault. Nothing have you done. You're diabetic. You take you go see the doctor. You take insulin. Same thing with psychiatry. Your hormone in the brain is low, so you go see. There's medication now in 21st century that can help. There is nothing. The stigma that psychiatrists is for psychosis, crazy people, it should be erased. And that's one way that you can get help, you know, with medication. If you help the stress, anxiety that you have, and I'm not saying that completely going to take care of it, but I can guarantee you majority of it will be helped.
Okay. Thank you so much. And what I told them, just let's put the politics aside. Let's talk medicine, right? اوكي انا هرجع مع حضراتكم تاني هنتكلم على فكره التشخيص and we'll get to the treatment in a little bit.
Yes.
هتكلم مع حضراتكم على فكره ازاي الطبيب، وده اللي كان بيتكلم عليه دكتور شمس. السؤال بتاعي ليه ازاي بنشخص ده. الرقم واحد انه البيشنت لما بيجي بنفحصه فحص كامل، ده مهم جدا. الفحص الكامل ده بيدينا انطباع او بيدينا فكره عن ايه طبيعه الموجود. بنعمل شويه اوردرز لشويه تحاليل عشان نتاكد انه ما فيش اي نوع من الالتهابات او الحاجات دي كلها. وبنعمل بعض يعني الاشعاعات باشكالها المختلفه هنناقشها مع حضراتكم دلوقتي. ولكن كمان زي ما دكتور شمس قال انه بنعمل اسسمنت لفكره الاسترس اللي موجود او الضغط الموجود في حياه البيشنت وازاي بيأثر عليه ولا لا. وكمان قال نقطه كويسه جدا ان احنا ممكن نعمل تيم ما بين الطبيب المعالج والسايكاتريست. وزي ما هو قال ان مش كل السايكاتريست هو بس بتاع، يعني الفكره اللي عندنا السايكاتريست بتاع الناس المجانين، لا، السايكاتريست بيبقى جزء مهم جدا في التيم عشان يشتغل على فكره الاسترس او القلق او الاكتئاب. لان زي ما انا قلنا 50% من السيدات تحديدا اللي بيعانوا من مرض القولون العصبي عندهم يا اما اكتئاب يا اما قلق عام، وده السايكاتريست بيتعامل معاه. الاكتئاب او القلق العام مش بس بيعتمدوا على فكره الستريس ريدكشن، ولكن كمان بيعتمدوا على الادويه. فممكن ندي ادويه تساعد الكلام ده. زي ما انا بقول دايما الادويه يمكن دايما ليها بعض الاعراض الجانبيه، ولكن هي الطريق الاول، او زي ما بنقول بتاتي اولا قبل اي حاجه تانية كسبورتيف ليها. فجزء مهم ان احنا ممكن نعمل تيم من 2 دكاتره بيبقى كويس جدا. But it's an important question. Is it important to exclude other disease, and what kind of other disease? We were talking about the tunnel vision, then we can.
Yeah, and that's very, very important. And I want everybody to know, just don't put everything in one basket, that you have this, you have that. You know, it's important. One of the things is inflammatory bowel disease. You can have basically like Crohn's disease, ulcerative colitis, which could be very life-threatening. So those could be the. So you have to rule that out. As I said before, when you have mucus, everybody is focused on, okay, is it a cancer? Which is a good thought. You really need to be sure.
So is it a good idea to do colonoscopy?
Well, at a certain age, yes, but I don't want everybody to think, okay, so I'm 50 years old and I'm not going to have colonoscopy until 50. As a matter of fact, I had a young girl, actually very interesting. It was in late 20s, early 30s. I insisted to do the colonoscopy because of all the symptoms, and find out there was a huge cancerous mass that she was lucky that they resected it. And
family history is important?
Family history is enormously important.
And the forewarning alarm criteria is very important, right?
Right. That's why I said history, and history.
Okay.
You talk to the patient, and that's the thing that you need to find out.
So the alarming symptoms, just to let them to our viewers.
Bowel movement changes. you know, basically your
Caliber.
stool, yes, your stool becoming very long, stringy, becoming harder, and there is no other things going along with it,
Right.
you know. And
Anemia,
what you
weight loss.
see, weight loss in general, not even in this, in general, my rule is, and everybody wants to, if you have weight loss, it's a cancer until proven otherwise.
Okay.
And that is very, have to stress that very big, it's really big.
الحقيقه زي ما قال دكتور شمس مهم جدا كمان للناس اللي عندهم قولون عصبي ان احنا نعمل بعض الاشعاعات والمناظير، تحديدا المنظار بيبقى مهم جدا في الحالات دي عشان نستبعد الحاجات التانية، خصوصا اذا كان في بعض الاعراض اللي بنسميها الالارم ساينز اللي هي بتنبهنا انه ممكن تكون حاجه اخطر، فاحنا لازم نستبعد كل الحاجات التانية العضويه عشان نشخص قولون عصبي، وده مهم جدا جدا جدا. نقطه يعني مش قادر اقول لحضراتكم قد ايه مهمه ان احنا نعمل ستريس عليها. لازم نستبعد كل الامراض التانية زي الكانسر، زي النتوءات اللي هنتكلم عليها، وانا عارف جاي لنا اسئله كتيره على فكره النتوءات هنتكلم عليها، فمهم ان احنا نستبعد الحاجات دي قبل ما نشخص قولون عصبي، لانه ده مهم جدا جدا جدا. هاخد فاصل ونرجع نتكلم مع حضراتكم على فكره علاج القولون العصبي، وهنتكلم بسرعه على النتوءات لانه جاي لنا اسئله كتيره عليها. ناخد بريك ونرجع تاني مع حضراتكم.
Are you tired of being overweight? Do you suffer from diabetes? Do you suffer from hypertension? Do you suffer from obstructive sleep apnea? Do you suffer from hypercholesterolemia? Have you suffered from heart attacks in the past? Strokes in the past? Are you tired of being ostracized in public? Well, I have a solution for you. Robotic bariatric surgery can completely change your life. I'm Dr. Bobby Baskerau. I'm a robotic bariatric surgeon. I do robotic weight loss surgery, which can completely change your life. I offer 3 different types of surgeries that can completely change your life: the sleeve gastrectomy, the lap band, and the Roux-en-Y gastric bypass. One thing that's very unique about our program is that we have a dietitian, and you will get counseled on what to eat, what not to eat, and how to optimize the utilization of your tool for good weight loss.
اهلا بحضراتكم في الجزء الاخير من حلقتنا النهارده اللي بنتكلم فيها زي ما انا قلت على فكره القولون العصبي وفكره الدايفرتيكيلوزيس، الاثنين مع بعض، او اللي بنسميها الجيوب او النتوءات او ما شابه يعني. فده مهم جدا زي ما انا قلت ان احنا نتكلم على الاثنين مع بعض. اتكلمنا على القولون العصبي، اتكلمنا ازاي بنشخصه، ايه الحاجات اللي لازم نستبعدها بشكل مهم جدا. زي ما انا قلت لحضراتكم في علامات لازم نعمل فيها منظار قبل ما نشخص قولون عصبي واحنا مرتاحين. اهمهم على الاطلاق هو لو في اي نزيف شرجي، ده لازم نعمل فيه منظار. لو في اي فقدان في الوزن بصورة كبيرة لازم نعمل منظار عشان نستبعد اي اسباب تانية للألم ده زي الكانسر والحاجات دي كلها. مهم جدا كمان لو في اي حد عنده انيميا ما بتتصلحش، بنحاول نديله حديد ما بتتصلحش. فده كله علامات بتبقى بتودينا دايما للمنظار. ولكن لو ما فيش العلامات دي بنستبعد كل الامراض العضويه التانية اللي ممكن تحصل في القولون ونشخص فكره قولون عصبي. الموضوع مش بس دقيقتين كده نسمع لواحد ونقول له انت عندك قولون عصبي. زي ما انا قلت فكره الاوفر دايجنوزيس كبيره جدا جدا وتحديدا في الشرق الاوسط. So now, how do we treat this syndrome or those like group of symptoms together?
Well, the first thing, my approach is to basically with the patient, talking to them and addressing their concept. And education, patient education is the most important thing, and try to educate them. And the second part of it comes diet. Because with manipulating the food that we eat, it can relieve a lot of the symptoms and help the patient. One thing is I want everybody to know that food intolerance is common. Food allergy is very rare.
Okay.
A lot of people say, you know what, I'm allergic to this food, that's why I get it, and that's not true. So, and as the other caller we explained to him, sometimes meditation, relaxation, it's a very good part of the treatment.
Okay. What about the diet itself?
Diet, I like to encourage people, actually it should be more of the fiber diet is the most important. And it's interesting, not only in this area, fiber is very good in colon, it's cancer prevention.
Okay.
One of the things that, they did a study in the United States that in Africa, the rate of cancer, colon cancer is very low, almost none, and they didn't know what the reason is, that it just doesn't make sense.
The westernized life.
Westernized life. And they got the stool from Africa and they examined it, high fiber, extremely high. So fiber is not only good for the IBS, and we're going to touch on it in a bit, but it's even cancer prevention is really important. So I do encourage my patient to, one of the treatment is just increase your fiber. Get away from the processing food. Get away from that.
So that's the benefit of not having a good economy sometimes. Is really
yeah, so there's always a reason behind, yes.
Okay. الحقيقة رقم واحد في علاج القولون العصبي بشكل عام ان احنا زي ما بنسميها بنعلم البيشنت، انه بنعلمه طبيعة المرض بتاعه، بنقول له ايه هي الاعراض اللي ممكن انت يعني تمر بيها. فتعليم البيشنت ده مهم جدا، انه البيشنت يبقى عارف عن حالته بشكل كبير جدا، زائد ان احنا لازم نشرح له ايه الموضوع بالظبط، لانه ده بيريح البيشنت بشكل كتير. الجزء الثاني اللي بقوله مهم جدا في الحكايه دي هو الدايت او الاكل، لانه الاكل مهم جدا في فكره القولون العصبي. زي ما قال دكتور شمس، الحاجات الغنيه بالالياف او الفايبر مهمه جدا، وزي ما هو اضاف كمان انه الاكل الغني بالفايبر او الالياف بشكل عام بيقلل حدوث الكانسر بشكل كبير حتى في القولون. يعني مش بس بيساعد فكرة القولون العصبي عفوا، ولكن بيقلل كمان نسب حدوث الكانسر. فالفايبرز او الالياف مهمة جدا في فكرة الاكل. زي ما هو قال كمان عملوا ستادي او دراسة عن الناس اللي في افريقيا وهنا. طبعا افريقيا بياكلوا اكتر نباتات، عوامل كتيرة جدا اقتصادية وغيره، ولكن هنا كمان بيميلوا اكتر زي ما انا قلت اللحوم المصنعة، الأكل المصنع، اللحوم، الفراخ، البروتينات بشكل عام. ده بيعمل لود كبير على الكدني. فزي ما بنقول برضو عشان ما حدش يقول ان احنا بنسبورت اتجاه معين، ولكن مش لازم كل الناس تبقى فيجيتيريان او فيجن بشكل عام. الاعتدال في الحاجتين، شوية من ده على شوية من ده كويس، انما فكرة التوجه للحوم المصنعة او اللحوم او الفراخ لوحدها كده بيبقى مش كويس. لازم يبقى يعني في فايبرز والياف كتير. Medication wise, how can we treat irritable bowel syndrome?
Well, as I said, there is a lot of psychiatric involved with the nervous system. So antidepressant is one of the medication that I have used, and it does help. We try to tend to address and target is it IBS, constipation or diarrhea, and treat it with medication. They have found out that tricyclic have a better effect on this disease. There is the newer drug like SSRIs do work, but not as well as tricyclic antidepressant.
Okay.
And basically, again, we target, but if it's the diarrhea part, increasing the fiber. Again, I really want to stress this fiber is very important in general. It's a bulk forming. And a lot of misconception people have that if I take fiber, I get diarrhea. Right. Why should I take that? Vice versa. But I explained that fiber in the colon, if you have diarrhea, it absorbs the water. So it makes it
forms bulk.
Exactly.
Right.
So it does help you. So, and vice versa. If it is constipation, fiber actually would release some of the water, make it moisture. So
So fibers is
balance
good
it.
for both patterns. Either.
Absolutely.
Okay.
Absolutely.
I have a question. When we keep saying fibers, what kind of food that does have fibers?
And that is because I tell my patient, fibers, well, doc, I eat wheat bread, I eat this and that, which is good. That's all good and dandy and fine. But you need the amount of fiber that you need. You need more than that.
Okay.
Like I tell them, you can buy these days fiber cards, citrus. There's a lot of different additional
So we can take it
fiber.
as a pill too, not
You
just
can,
in food.
not only pill, you can take it as a wafer. It comes in so many different forms, fiber.
Fruits and vegetables.
Fruit
are
and vegetable is one of the things that investor
Has a lot of
it's missing. It's missing. Definitely, fruit and vegetable have a lot of fiber.
اوكي. الحقيقه جزء زي ما انا قلت من العلاج كمان هو الدايت. قعدنا نقول فايبرز، الياف بتبقى موجوده في الخضار، فواكه. كمان دكتور شمس قال على نقطه مهمه، انه اللي طريقه اكله بشكل عام مش كويسه ممكن ياخد الفايبرز او الالياف دي في حبوب بنسميها الفايبروكون، بتساعد بشكل كبير جدا. قال نقطه كمان مهمه، انه الناس متخيله ان كل ما بتاكل فايبر هيجي لها اسهال. الحقيقه انه ده مش صح، لانه الفايبر بيساعد على امتصاص الميه في القولون نفسها، فبيكون بالك. فالفايبر مهم جدا في الاسهال وفي الامساك. الفايبرز مهم جدا، الالياف مهمه جدا كجزء من اكلنا اليومي، لانه زي ما انا قلت مش بتساعد بس في فكره القولون العصبي، ولكن بتقلل نسب حدوث الكانسر. نقطه تانية مهمه زي ما هو قال، انه جزء نفسي كبير جدا في موضوع القولون العصبي. احيانا بنلجأ لدوز خفيفه جدا او صغيره، جرعه صغيره جدا من مضادات الاكتئاب وبتعالج بشكل كبير، واحيانا بندي ادويه تانية عشان تساعد فكره الامساك او الاسهال بشكل كبير جدا. ولكن زي ما انا قلت قبل الادويه مهم جدا ان احنا نشتغل على فكره الاسترس، الدايت، الفايبر. فايبر يعني ممكن نقعد نقولها لبكره الصبح. الحاجه الثالثه بعض مضادات الاكتئاب بجرعات صغيره. الحاجه الرابعه انه بعض الادويه اللي بتساعد على فكره لو حضرتك عندك امساك نشتغل على ده، او عندك اسهال نشتغل على ده، فده مهم جدا. I think very much covered like the irritable bowel syndrome. Final message about irritable bowel syndrome before we talk about diverticulosis.
The last thing that I want to say is, we talked about the treatment for the constipation, for the diarrhea part, but the pain is real. I don't want people to think it's all in my head and, it's not. You have pain. And the treatment, again, is directed to the constipation, diarrhea, or the pain. Pain could be a little bit harder to treat because, the colon have muscle. The nerve, and it gets basically called a Charlie horse. The leg gets cramped. You get in the colon, so you take antispasmodic medication and for bloating. One of the things I believe in holistic medicine because everything you put in your mouth is a drug.
Right.
So have side effects. So Mother Nature, I think, knows better. I try to do the least amount of drug as possible. That's why I keep stressing on the fiber as opposed to other stuff. But if you have spasm, you need some muscle relaxant for the colon. So I use.
So if we need medication for real, we do medication.
Absolutely.
And some people, as you think like a small dose of antidepressant because they're psychotic or something, but it's helpful to
very
use
helpful.
those. زي ما أكد دكتور شمس، بس عشان قبل ما ننقل على فكرة الدايفرتيكيلوزيس، إنه مهم جدا انه ناكل بشكل كويس، مهم جدا انه ناكل فايبرز او الياف بكميات كويسه. القولون نفسه بيبقى فيه انقباضات عنيفه جدا، فرسالته للمرضى بتاع القولون العصبي انه احنا زي ما بنقول سامعينكم، يعني شايفين انه فعلا في مرض، ده مش في دماغكم بس وخلاص، لا في الم احنا شايفينه، في ظاهره اسمها القولون العصبي. زي ما انا قلت مجموعه اعراض على بعض، ولكن قبل ما اشخصها لازم اعمل تحاليل واشعات او مناظير عشان استبعد كل المشاكل التانية، عشان اتاكد فعلا ان ده قولون عصبي، ما شخصش المريض كده عمال على بطال وخلاص، زي ما بيحصل كتير جدا في الشرق الاوسط. Diverticulosis, one of the opposite age, like toward older people most of the time. So what's diverticulosis?
Yes, very interesting. Actually, it's a very interesting disease, if you want to call it, the syndrome. It's, as previously I showed, there was the colon is a big tube. And I like to explain it to my
25 slide 25.
patient. Yes, to my patient, I say it's just like your tire on your car. You drive it for a while, what's happened, sometimes it bubbles out. And in the colon, the same thing. The colon is wall. So the wall become kind of weak, and what happens is bubbles out. And those bubbles, pouches, we call it diverticuli.
Okay.
Diverticuli become, again, in Western hemisphere, because of our diet, it's unfortunately very, very common. Okay. Very common. Most people do have it, and it's in general public. And when you do colonoscopy, if we go to slide 26, it will look real. It looks like basically caves. When you look with the scope into the colon.
Like a pocket or something.
Yeah, but those pockets that you see in the slide, like a cave, those are called diverticuli.
Okay.
And it's just out-pouching of the muscle weakness in the colon. That's diverticuli. Okay. Or we call it diverticulosis, which is very common.
Okay. And when it gets inflamed, we call it?
Then once those, sometimes what happens is those diverticuli, food particle, like small seed, they get trapped in there and basically called inflammation.
Okay.
Inflammation causes basically infection. And infection, that's called diverticulitis.
Okay.
IS.
So those pockets get inflamed.
Inflamed.
And that can be serious.
And that could be very, very serious. Okay. And what's going to happen if it gets bad enough, it's going to start bleeding.
Okay.
So the people will see frank blood coming out of the rectum, and that's that's why they present themselves to the emergency room. And the pain is very unbearable. It's like the way they describe it is like somebody have put a knife and basically moving it around.
Wow. Is it that painful?
It's very painful. Okay. It's very painful.
And sometimes it can perforate as well.
If it perforates, then you go into shock and stuff.
Okay.
Yes, but that is way down the road. Hopefully, we don't get to that stage. By the time they have the amount of pain they have and the bleeding will get them to come and seek medical help. One thing with diverticuli and diverticulosis is more, you can have it anywhere in the colon.
Okay.
You can have, as at the beginning of the talk, I said we have ascending, descending, sigmoid. But most majority, statistically, diverticulum is in the basically sigmoid colon and descending colon. That's the majority of it. And that's why you see the bright red blood.
Okay. I have a question here about barium enema, and it released, the result had some polyps. Is it important to do colonoscopy with polyps?
Okay, so I don't want people to misunderstand. Polyp is totally different than diverticulum. Just remember, colon, you have this tube and it have odd pouches. And the polyp is actually a growth inside.
Okay.
And when you do the barium enema, if you see that those polyp needs to be removed and tested, because again, heredity, as you said before, play a really, really important role, because that could potentially become cancerous.
Okay.
So that they definitely need colonoscopy.
Okay. الحقيقة برضو موضوع مهم بنتكلم فيه مع حضراتكم النهارده، فكرة الدايفرتيكيلوزيس أو البوكيتس اللي بتحصل من القولون. لو جبنا تاني الصور اللي معانا، لأنه هتوري حضراتكم بالظبط أنا أقصد إيه، لأنه الحقيقة دورت على تراجم كتير بالعربي والموضوع بيبقى صعب جدا. بيبقى بوكيت كده بيطلع من القولون نفسه. يا ريت نجيب معانا السلايد عشان نوري الناس بتبقى عاملة إزاي. القولون نتيجة الأكل هو ده بالظبط كده. لو نحط البوينتر على البوكيت اللي تحت ده، هو ده العلامتين اللي موجود عليهم الدايفرتيكولايتس، الدايفرتيكيلوزيس، نتيجة انه بيزيد نتيجة الاكل اللي فيه فايبر قليل. فبأكد تاني الفايبر مهم. نتيجة ان احنا ما بناكلش الياف كفاية، نتيجة ان احنا بناكل بروتينات والحوم بشكل كبير. وبرضه تاني مش معنى كده ان احنا ما ناكلش بروتينات والحوم خالص، كل حاجة باعتدال كويسة. الضغط جوه القولون نفسه كأنبوبة بيزيد بشكل كبير جدا، وبيضغط على الوول او الجدار بتاع القولون، وبيعمل البوكيتس اللي هي في الجنب دي اللي هي بنسميها بالظبط كده الدايفرتيكيلوزيس او البوكيتس دي. ممكن يحصل فيها التهابات بنسميها دايفرتيكولايتس. او ممكن ان هي في حاجات يعني زي ما بنقول تركن فيها فتسبب شويه نزيف شرجي بشكل كبير جدا. على اللونج ران ممكن زي ما بقول انه يحصل فيها بعض الالتهابات، وهنا بيحصل الم شديد جدا. النتيجه البوكيتس دي انه بيركن فيها حاجات احيانا بتعمل الم لانها ما بتمشيش مع حركه القولون بشكل كبير جدا. Symptoms and signs for diverticulosis and diverticulitis.
Diverticulosis usually majority of people don't know they have it because there is no pain. There is it's just basically outpouching, and that's it. When it becomes diverticulitis is when the pain starts. As I said, then they start having basically the left lower quadrant of the abdomen become very painful, tender, and usually it's related with constipation.
Okay.
Because if you're constipated, you put more pressure on the wall and you get the outpouching.
Again, low fiber,
And
right?
again, we go back. I don't have any stock in the fiber company, but it's fiber is the most important thing. And unfortunately, we do a lot of just processed food and not enough fruit and vegetable and grains. And fiber will make a bulk and basically strengthen the muscle in the colon. And
Can
so diet.
diverticulosis have symptoms, like just vague symptoms?
You could have some discomfort, you know,
Like
bloating and stuff,
yeah.
yeah. And but in general, once it becomes diverticulitis, when it becomes inflamed, and like if they eat poppy seed or basically cucumber seed and stuff that gets stuck in the outpouching and become inflamed, then they become very painful. That's the first symptoms.
No popcorn with diverticulosis?
No. No. Again, you could have everything, but if your diet is good in fiber, bulk forming, as long as you don't get constipated. Once you get constipated, it causes a lot of problem.
Okay. الحقيقه بعض الاعراض اللي بتبقى موجوده في الدايفرتيكيلوزيس او الدايفرتيكولايتس او البوكيتس اللي بتطلع في القولون، الجيوب الجانبيه دي اللي بتطلع في القولون، احيانا الدايفرتيكيلوزيس لو ما فيهوش اي التهابات او اي حاجه بيبقى فيه شويه احيانا امساك، شويه عدم ارتياح، زي ما بنقول احساس بالامتلاء. الكلام ده كله بتبقى سيمتومز مش واضحه قوي او اعراض مش واضحه قوي. الاعراض بتظهر بشكل كبير جدا لما يحصل فيه التهاب ويبتدي تظهر كل الاعراض الكبيره، وخصوصا الالتهابات دي بتحدث نتيجه انه امساك لفتره طويله، فبتخلي الدايفرتيكيلوزيس دي تبان وتتحول لالتهاب في الجيوب اللي وريناها لحضراتكم في القولون. وهنا بيبتدي يحصل الألم الشديد جدا، ممكن يحصل نزيف شرجي بشكل شديد جدا، والموضوع بيتطور كمان لأصعب من كده بشكل كبير. The main reason for diverticulosis and diverticulitis?
The main reason for diverticulosis, again, we go back to the diet and not having enough fiber in it, and the muscle of the colon basically become weak. And there have been some study linking in, again, to genetic. But the problem is majority of the people, they do have diverticulosis.
Okay.
And again, if you don't eat the right thing, become diverticulitis.
And it can get serious.
It gets very serious because, as you said correctly, if it's perforate, then it's a major surgery. And survival is very rare. So you need to, if you have that much pain, it's better to be safe than sorry. Check it out.
And we have a very nice slide here for the fiber stuff, slide 13 maybe.
Exactly. That,
because a lot of people are sending questions about what's fiber. Well, exactly.
What's fiber?
The slide is...
Yeah, this slide, number 30, goes through the basically different source of fiber. As you can see, fruit and vegetable is very high in fiber, grain, beans, bread. People tend to get...
Not the white bread? Or?
No, that's what I'm saying. People tend to get white bread and stuff, but instead of that, get wheat bread.
Okay.
Anything is better than nothing.
Right.
And supplemented with other things. And the most important thing, again, is having the stool not to be hard. So how do you do that? Increasing your fluid intake. And one thing I want everybody to know that's important is water. And because a lot of people say, well, I drink a lot of tea or coffee, I drink a lot of Coke or Pepsi or orange juice or whatever.
That dehydrate them more.
Yeah, that's not water.
Okay.
Simply say water is water.
Okay.
That's it. It's not that hard.
That's a very simple, direct, straightforward message.
Yes.
Right. الحقيقه برضو جاي لنا اسئله كتير على فكره انتوا قاعدين تقولوا الياف الياف، فالحقيقه احنا جايبين لحضراتكم سلايد بنتكلم فيها على مصادر الالياف بشكل عام. كل الخضار والفاكهه زي ما حضراتكم شايفين مصدر جيد جدا للالياف. واحده من الحاجات اللي بنهتم بيها جدا انه العيش اللي بناكله يا ريت بلاش العيش الابيض او الفينو او كل الحاجات اللي بالشكل ده. العيش الاسود العادي اللي بالرده ده بيبقى مصدر جيد جدا للالياف في الجسم، ودي واحده من اهم الرسائل بتاعتنا النهارده، انه العيش اللي بالرده ده مصدر جيد جدا للفايبر او للالياف، زي ما احنا بنقول كل انواع الخضار والفاكهه. نقطه تانية مهمه جدا قال عليها دكتور شمس، الميه. مش عايزين يعني ممكن اقعد اتكلم فيها كتير جدا. الميه مهمه جدا يوميا. ناس كتير قوي زي ما هو قال بتيجي تقول لنا انا بشرب سوائل كتير، بشرب قهوه كتير، وبشرب شاي كتير طول اليوم. ده بيعمل العكس، لانه ده بيدخل التواليت بشكل كبير جدا، وبيعمل جفاف اكتر منه ما بيعمل هايدريشن بشكل كبير. فبلاش فكره الشاي والقهوه الكتير، بالذات لمرضى القولون العصبي، كمان للمرضى اللي عندهم دايفرتيكيلوزس او عندهم الجيوب دي اللي هي بتاعه القولون. بلاش شاي وقهوه كتير، بلاش كحوليات بشكل عام، كل ده نتجنبه تماما. الميه زي ما قال دكتور شمس، ميه هي الميه احسن حاجه واحسن مشروب نقدر نشربه يعني كل يوم، ولازم نشرب كفايه من لتر ونص ل 2 لتر في اليوم. How can we treat diverticulosis or keep it under control plus fiber and water? Anything else?
Exercise, being healthy. But one thing I want to stress, people, I keep saying fiber, but if you're actually in flare-up of diverticulitis, they should not take fiber because that's going to make things worse.
Okay.
So you treat the diverticulitis, you treat the inflammation, you
then
treat
you
the
go
bleeding.
back.
Once that's resolved, then you should modify your lifestyle.
Okay. One final message about irritable bowel syndrome and diverticulosis, or like the health of our colon in general, to our viewers today.
Again, we have to take control of ourselves. That's the bottom line. And if you do the right thing, eat the right food, do the exercise, cut down on your caffeine, cut down on alcohol, smoking, all those things, we have to take control of it. And that will, as you said, third country in Africa, much healthier than the United States.
Right.
So why? Because they are basic, not taking medication. The answer to everything is not medication.
Right.
Mother Nature have everything out there for you.
That's a very nice message at the end. Thank you so much, Dr. Shams.
Thank you for inviting me again.
It's always a pleasure for me and for our viewers having you.
Thank you very much.
الحقيقة الرسالة الأخيرة بتاعت دكتور شمس إنه لصحة القولون بقى بشكل عام، سواء القولون العصبي أو الدايفرتيكيلوزس، قلت له لو سمحت قول لنا مسج أخيرة عن فكرة صحة القولون بشكل عام. الرقم واحد إن إحنا طبعا وبنقولها في كل حلقة، بلاش تدخين، بلاش كحوليات، لأنه دي بتبقى مضرة جدا. الحاجة التانية ناكل صح، ناكل كويس، وناكل نسبة ألياف عالية عشان ده مهم جدا. في الآخر المية مهمة جدا جدا، لازم نشرب كميات مية ما تعنيش شاي وقهوة، مية تعني مية زي ما بنقول كده باختصار شديد يعني. ده مهم جدا لصحة القولون بشكل عام. الحقيقة المسج الأخيرة اللي أنا عايز أقولها إنه أي أعراض محتاجة أدوية تسألوا عليها الطبيب المختص في المجال ده فقط. مهم جدا زي ما بنقول لكل السادة المشاهدين، أول ما أشوف أي حد قاعد على أي شاشة بيتكلم على فكرة أدوية أو حاجة، لو مش دكتور يبقى احنا بنتكلم مع الشخص الغلط. فكرة الشخص أو الضيف المظبوط أو المؤهل أو الطبيب هو فقط اللي يتكلم على فكرة الأدوية والعلاج والكلام ده، غير كده بيبقى الكلام مش صح قوي. زي ما أنا بقول لحضراتكم، كل أدوية ليها بعض الأعراض الجانبية، ولكن بنعمل حاجة اسمها كوست بنفيت ريشيو. أحيانا الدواء بتبقى فوائده أكبر بكتير جدا حتى لو له بعض الأعراض الجانبية. بشكر حضراتكم على التفاعل والاستماع، وبشكر حضراتكم على تفاعلكم على الفيسبوك. أنا عارف إنه أسئلة كتير جات لنا، ولكن غطيناها كلنا في البرزنتيشن، عشان كده حاولت إن أنا ما أخدش أسئلة كتير. بشكر حضراتكم على السبورت العام لوايت كوت وعلى قنوات الكرمة، ومستنيين دعمكم وتعضيدكم على السوشيال ميديا، ونشوفكم على خير إن شاء الله، وحلقة جديدة من وايت كوت الأسبوع الجاي.